USMLE style question, Thymoma. A 45-year-old man presents with progressive muscle weakness and ptosis. The weakness is worse in the late afternoon and improves with rest. His medical history is significant for difficulty swallowing and double vision. On physical examination, he has ptosis and mild dysphagia. Chest X-ray reveals a mass in the anterior mediastinum. Laboratory tests show elevated acetylcholine receptor antibodies, suggesting an autoimmune condition. Which of the following is the most likely underlying diagnosis? A. Thymic hyperplasia. B. Thymoma. C. Small cell lung carcinoma. D. Bronchogenic carcinoma. E. Paraganglioma. Answer B. Thymoma. Explanation. This patient presents with classic symptoms of myasthenia gravis, including progressive muscle weakness, ptosis, and dysphagia. The positive acetylcholine receptor antibodies further support the diagnosis of myasthenia gravis. Thymoma is a well-known paraneoplastic condition associated with myasthenia gravis. Thymomas are tumors of the thymic epithelium that are often located in the anterior mediastinum. About 15 to 30% of patients with myasthenia gravis have an associated thymoma, and the presence of a mediastinal mass on chest imaging is characteristic of thymoma. Thymoma may be associated with autoimmune disorders, including myasthenia gravis, hypogammaglobulinemia, and systemic lupus erythematosus, SLE, why other choices are incorrect. A. Thymic hyperplasia. Thymic hyperplasia can also be associated with myasthenia gravis, but is usually diffuse and does not form a mass. It is less likely to be identified as a mass on chest imaging, unlike thymoma, which presents as a well-defined mass in the anterior mediastinum. Small cell lung carcinoma. Small cell lung carcinoma can cause paraneoplastic syndromes such as SIACH or Cushing syndrome, but it is not typically associated with myasthenia gravis or a mediastinal mass. Additionally, small cell lung cancer often presents with symptoms of pulmonary disease and weight loss, which are not prominent in this patient. D. Bronchogenic carcinoma. While bronchogenic carcinoma can be associated with paraneoplastic syndromes, it is not linked to myasthenia gravis or mediastinal masses in the same way as thymoma. This patient has a mediastinal mass, which is more suggestive of a thymoma than a bronchogenic carcinoma. E. Paraganglioma. Paragangliomas are rare neuroendocrine tumors that arise from neuroendocrine cells and are most commonly found in the neck and pelvic region rather than the mediastinum. They are typically catecholamine-secreting tumors and do not present with the symptoms of myasthenia gravis. Clinical relevance. Thymoma is a tumor originating from the thymic epithelial cells and is most commonly found in the anterior mediastinum. It is often asymptomatic, but can present with paraneoplastic syndromes like myasthenia gravis. Myasthenia gravis is an autoimmune disease characterized by autoantibodies against acetylcholine receptors at the neuromuscular junction, leading to muscle weakness that improves with rest. This condition is frequently associated with thymoma, though it can also occur in thymic hyperplasia. Diagnosis of thymoma is often confirmed with imaging, e.g. CT scan of the chest and biopsy. The diagnosis of myasthenia gravis is confirmed with acetylcholine receptor antibody testing. Treatment of thymoma may involve surgical resection, and myasthenia gravis can be managed with acetylcholinesterase inhibitors and immunosuppressive therapies. Would you like